Hi, this is Brian Kim. I'm going to share with you case number 224 in the best way to do cataract surgery series. And the purpose of that title is not to say this is the best way, but to get you thinking about always trying to strive to provide the very best surgery for the patient. And that means constantly fine-tuning your technique. And you'll see throughout this series how I constantly try to change and evolve my technique to make it better and safer for the patient. And so this is a hypermature cataract, and you're going to see the use of Trypan blue to paint the anterior capsule surface. And because this is a rather dense lens and I want to avoid the posterior plate phenomenon, I'm going to perform the terminal chop, and you'll see what I mean by that. And then after that, I'm going to be performing cross-chop techniques, which will allow me to chop the lens from different angles without having to spin the lens, and then leveraging mechanical fracturing concepts to reduce CDE and reduce corneal damage, and then finally placing the LI61AO lens. So you can see this is the lens. It's rather dense. This is a corneal marker, which will help me to center and size the rhexis. And then using the cotton tip, I control the eye and turn it a little bit so I can approach the eye with the blade flat to iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. You want to be parallel to iris plane. This is intracameral epinephrine. And then we'll switch and put some intracameral air. You want to decompress the aqueous inside the chamber, and then push some more air, and this allows you to get a bigger air bubble doing it this way, just like that. And this is the Trypan blue. I'm going to try to paint the anterior capsule surface. Of course, sometimes the bubble will just come out of the incision. Of course, you try to do the best you can and continue to paint the anterior capsule surface. And this is some dispersive viscoelastic to push the dye out and the bubble out as well. And then using that same cannula to control the eye, this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, and then when I am ready, I go ahead and dive down and enter. This is the puncture style technique using these Moria forceps. Puncture the center, pull down, and it is a sharp tip forceps. I'm able to pull down and push a little bit to the right to create a flap. And then I'm going around circumferentially. You can see because the instrument is low profile, I have very minimal OVD egress, excellent control of the rhexis. I don't have any radialization forces as I'm doing the rhexis. This is really the way I do capsular rhexis now, using these micro forceps. This is the capsule fornix hydrodissection technique. I first burp that capsule out. I go under the rhexis edge contra-incisionally. You get a nice wave. Decompress the bag, and then the lens begins to spin. Again, in these dense lenses, the bag and the lens are fairly disassociated anyways. Irrigating the surface of the eye, lifting the incision with a chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, turning the bevel up now, and I'm going to go ahead and sculpt. Of course, the Trypan blue allows great visualization. I switch to the dense cataract mode. This is not my standard mode. Normally my standard mode uses torsional only and minimal longitudinal. I'm going into sculpt mode, which is primarily longitudinal in nature. So because of terminal chop, you're not going to be cracking from the surface, and you're going to have a targeted chopping force. And so you can see I'm sculpting nice and deep. I want to make sure I remove that dense central core. That's the key. But I'm not necessarily wanting to get all the way to the posterior capsule. There's always a risk of buzzing the posterior capsule, and so I'm not going to do that. So I go ahead here, I place the chopper under the rexus edge contra-incissionally. So you can see the angle of the chopper is at the same horizontal plane as the anterior surface of the lens, which means the tip of the chopper is down parallel to the densest part of the lens itself. And then I'm pushing with the phaco tip and crushing that peripheral edge, that terminal piece of lens material, which propagates through and through. And so that's the beauty of terminal chop. Now I place the chopper under the right heminucleus, same thing. Again, the angle of that chopper is on the same horizontal plane as the anterior lens material. That means the tip is down at the same horizontal plane as the densest part of the lens. I have the phaco tip positioned deep in the bag, in that trough, and I'm going to pull that chopper towards the phaco tip. And because the phaco tip is stationary, I'm able to crush the lens against the phaco tip. Again, the phaco tip is acting like a chopping block. Positioning the instruments around that first quadrant, and then bringing the instruments together, and then cutting that lens piece in half, and then spreading and cracking. Lifting that first fragment up with some high vacuum, and then crushing the lens into smaller and smaller pieces, and then fluttering my foot pedal. Again, doing this to minimize ultrasonic energy. Again, crushing the lens pieces into smaller and smaller pieces with mechanical fracturing forces. And then once the pieces are small enough, emulsifying it with ultrasonic energy and vacuum. Turning that second quadrant in front of me. Performing again a terminal chop maneuver there. Separating that second quadrant from the rest of the lens. Performing a cross chop maneuver, spreading and cracking the lens pieces apart, and then again leveraging mechanical fracturing forces to crush the lens pieces into smaller and smaller pieces. Again, this is under irrigation only. I'm just using irrigation to keep the eye inflated, and then positioning the instruments around the lens pieces to crush it. By doing it this way, I utilize less ultrasonic energy and vacuum during these crucial steps. And as you can tell, there is very little epinucleus in this case, and that's because with dense lenses you don't tend to have as much epinucleus, therefore you don't have as much posterior capsule protection. And so again, it's very important in these cases to be able to leverage mechanical fracturing forces so you're not indiscriminately using high vacuum or ultrasonic energy near the posterior capsule. When I'm fracturing the lens pieces, even though the phaco tip gets close to the posterior capsule, I don't have to worry because I'm not initiating any vacuum or ultrasonic energy while I'm cutting the lens. When I'm crushing the lens, again, the phaco tip is acting as a mechanical fracturing instrument. Once I've fractured the pieces and I decide to emulsify the lens pieces, then I have to be very careful, and then I treat that phaco tip like it's intended to be, and I keep it away from the posterior capsule, and then I go ahead and initiate vacuum and ultrasonic energy. And by doing it this way, again, the phaco tip has dual functions. Go ahead and turn that second heminucleus in front of me, and you saw I was able to position the chopper around the lens and then placing the phaco tip deep, and then essentially crushing the lens with mechanical forces. Again, this is under infusion only, not using any vacuum or ultrasonic energy. You don't have to hold the lens. You don't have to buzz into the lens material. Again, anytime you buzz into the lens material, there's always a risk that you can hit something. So you can see right here with that fragment, I'm just trying to position the instruments around the lens. Sometimes I'll use a little vacuum to get it to the tip, but the point of the matter is this is essentially under irrigation only when I'm trying to position the lens material. So again, it's a little bit of practice. There's a different way to do cataract surgery, but by taking the vacuum and ultrasonic energy out of the equation, by not depending upon lollipopping the lens or trying to use vacuum to grab the lens piece. You know, you're trying to do aspiration, you're trying to get purchase, you're trying to push the phaco tip against the lens material, buzzing into it, and then trying to get purchase. It's just a riskier way of doing things. It's not really very safe, in my opinion, especially when you're dealing with a situation where you have less pieces. So when you have only like 2 pieces or even the last piece, You certainly don't want to be going towards the piece with your phaco tip and trying to use vacuum and then pulses of ultrasonic energy to grab it. If you do it that way, again, you don't have any protection for the posterior capsule. So a more efficient way and less risky way is really to position the instruments around the lens and crush it. By doing it this way, you don't have to depend upon ultrasonic energy or vacuum to disassemble the lens. So you can see very carefully and gently and methodically, I use mechanical fracturing forces to cut up those last pieces. And again, very mindful of the posterior capsule during those maneuvers. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. There's one piece that's flying around. I grab it with the INA, and then I mash it into the tip with the BSS cannula. Start removing the remaining cortical material. Again, this is a dense lens, and when you have a dense lens like this, you don't have as much epinucleus. Again, another reason why in dense lens situations, sometimes people have a higher risk for posterior capsule rupture because they try to go after these pieces with vacuum or ultrasonic energy, right? They have cracked the pieces and they go after each quadrant and fragment using high vacuum to pull it out of the bag. That is such a terrible way to do the surgery, but that's the way we all learn how to do it. You push the phaco tip against the lens piece, you go and then you try to grab it. Why do it that way? You might accidentally grab the posterior capsule. So instead, just hook the lens with the chopper, pull it out of the bag mechanically. It's such a more efficient and safer way to disassemble the lens. So you saw I was able to clean the bag with the INA and then use the BSS cannula to pulse into the subincisional space, and you saw some material was liberated. Again, I like using that technique because why? With bimanual, you have two metal INA hand pieces, and metal is just, you know, it could have a burr and you might nick something in the bag. I like this polymer tip, so I choose to do a coaxial INA, but then I use that cannula to pulse into the subincisional space. So this is the LI61AO. This is that small cartridge. I push viscoelastic into the bag first, and then I get that injector all the way to the hub. And very gently and carefully, slowly, I'm injecting that leading haptic into the bag. And you have to rotate your hand, the barrel, because you want to make sure that the lens comes out the way it's supposed to. And very slowly, I make sure that the optic comes out in the proper orientation. Right here, I just let go, and it just shoots out. Yeah, you don't want to push too hard. When you start to see it start coming out, just stop, and it'll just shoot out on its own. And then you withdraw the plunger, and then you can try to put the trailing haptic in as well. I'm not, again, as facile with this injector, so I don't want to get too crazy with it. And so once I got it in, I just go ahead and stop, and then I can use a second instrument to dial that trailing haptic in. It's no big deal. This is just a BSS cannula, so yeah, not a big deal at all. I go in with irrigation off, activate irrigation, get underneath the lens, removing all the viscoelastic from within the bag. And then I'll remove the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a hypermature lens. You saw terminal chop. Again, the concept is don't try to crack from the surface. It's difficult to do that. So this is essentially like a modified stop and chop, but instead of cracking from the surface, which is very inefficient, you want to debulk the central core, and then you're going to fracture from the terminal edge. And by fracturing from the terminal edge, you're placing the chopper out to the equator, you're crushing the lens material that's right at that equator level between the chopper and the phaco tip, and then that fractures that component of that lens, which goes all the way around circumferentially down towards the posterior capsule. So you're going to get a through and through chop all the time, and that's why this helps bypass that posterior plate phenomenon. And then I place the chopper around the right heminucleus and perform the cross chop, right? The chopper is placed into the capsule equator. I pull it towards the phaco tip, which is again in that trough, but it's flanking. Remember, the instruments are flanking the lens. So as I pull that chopper towards the phaco tip, it crushes the lens, right? Because the lens doesn't stand a chance. This is metal on metal. When I bring metal towards metal, it's going to amputate and cut that lens material. So then you keep doing that concept of basically crushing the lens with the chopper and phaco tip. Again, I do that on a regular basis, whether it's a dense lens or a small lens, because I've built that habit into my surgery. And so when you have a case like this where there's no epinucleus, you have nothing to protect you from the posterior capsule and the phaco tip, I'm able to still leverage mechanical fracturing forces and very efficiently pull lens pieces up out of the bag. Again, don't ever go after lens pieces with high vacuum with the phaco tip in the bag. I think that's really not a great technique, and you're going to get burned. You might get away with it, but really you just ask yourself, you're just putting yourself at risk. You know, it's like walking down a dark alley in a big city at midnight. I mean, you might be fine when you do that, but why put yourself in that situation when you don't have to, right? So again, mechanical fracturing, efficient, easy way to disassemble the lenses, especially in this hypermature lens. So I hope this was helpful to you, and I thank you for your attention.